Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! As we may contemplate plastic surgery procedures, particularly cosmetic or aesthetic, one thought that may run through our minds is, am I going to have a good result or am I going to have a bad result? And that begs the question, is there such a thing as good plastic surgery and bad plastic surgery? Well, that's a question we really want to answer today in our episode. As we consider all the factors that play a part in determining an outcome, we think about things such as provider qualifications and skills. We think about patient expectations and patient openness to realistic results. So what is bad plastic surgery? Well, that question has kind of an elusive answer. But to help us with that, today we're speaking with Dr. Thomas Francel, who has some great ideas about identifying bad plastic surgery, correcting it if possible, and even preventing it. And he's got some great stories to tell. Let's listen to that conversation right now. Well, today we have Dr. Thomas Francel, a board-certified plastic surgeon in private practice in St. Louis, and he's the author of a new book relating to our topic today. Welcome, Dr. Francel.
Well, thank you. Thank you for having me, Regina.
Great. Well, let's start by having you give us a brief sense of your plastic surgery journey. How did you get to this point? How long have you been in practice? And what type of cases do you mainly focus on?
Oh, it's one of those stories that you start off wanting to do something and then you end up doing something different. But I went to medical school thinking I was going to go into emergency medicine. Didn't like that at all. Then I was doing orthopedic surgery. It was okay. Then I did a 6-week rotation with a family friend back up in Toledo, Ohio. He was a 58-year-old plastic surgeon in a peak of his career doing all these wonderful things, including he had all the burn stuff. He did a lot of hand surgery and just the whole assortment of plastic surgery. And I was fascinated. And he spent a lot of time with me in those 6 weeks because he kind of caught my interest. And so he just kept on giving me stuff, little tidbits. I go back to my medical school and I say, I don't want to do orthopedics. I want to do plastic surgery. And the guy was nice enough to help me through. He got me into my general surgery training. And then once I was there, it was just a matter of working with all the plastic surgeons. And then I ended up down at Hopkins to do my plastic surgery, and then came out to St. Louis in 1991 in my academic position at WashU until 1998. And then I came out in private practice in 98. And I started off in the typical, doing a lot of stuff. 90% of my practice right now is cosmetic in nature, one way or another.
Well, that's been quite a journey, and I'm glad we have you here because you have just written a book that aligns with our topic today about the concept of good plastic surgery and bad plastic surgery. I mean, I hate to break it down into those rather simplistic terms, but really that's what people want to know about and watch out for as they consider embarking on a surgical procedure. So could you tell the listeners the name of your book and why you felt compelled to write it?
Right. It's called Exposing Bad Plastic Surgery and the Secret to Avoiding It. It started in, Botched first came out in 2014, and I was at a restaurant in Los Angeles in 2015, at this cocktail party, and there was a lady there who was a makeup artist to the stars. And she's the one who does all their makeup before their big shows, or if you see in these tabloids, they have before and after makeup pictures. Well, she's kind of the one who doesn't. She does a fabulous job. Well, she accosted me and she said, "Why is there so much bad plastic surgery out there?" She said, "There's a lot of stuff I can fix with just makeup. Like the example she gave is, she can make Owen Wilson's nose straight
Ah,
before he leaves the house because he has this really crooked nose." So, I mean, this kind of prompted this whole thing. And we talked for about 2.5 hours. And the next day I started writing. And the title of it is what she said, Bad Plastic Surgery. And my thought was why people have bad plastic surgery and then how to avoid it. And so the whole second part of the book is how to avoid it.
well, we want to hear your thoughts about that. But first, let's just define what good plastic surgery is. What are the usual goals or ideals? I mean, change appearance but look natural, maybe notice a surgical result but not have it be too noticeable, minimize scars, all that kind of thing. What are your thoughts?
Right. I mean, that's a very difficult thing to really put your finger on. I mean, when I first started writing and somebody asked me that question, it is kind of like there was a judge in Ohio in 1960 something about pornography. And he said, "I can't describe it, but I know it when I see it."
Yeah.
And it's kind of the same type of thing with bad plastic surgery. I mean, people think of plastic surgery as being artificial or fake or synthetic or phony, all that kind of stuff. And this really doesn't have to be, which kind of gets into what is good plastic surgery. So there are some aesthetic ideals that people should look up to. Aesthetic ratios in the face, the breast to hips, breast to abdomen, all this kind of stuff too. On the other hand, if somebody is absolutely perfect, they don't look right.
So true.
I mean, you can always say you get this perfect person, and there's always a little bit of a weird type of feeling if you get somebody who's perfect. Because people are kind of used to being asymmetrical. And even as little babies and stuff like that, their perception is that if somebody is asymmetrical, that's not actually unusual. And so you don't have to be completely symmetrical to be beautiful. So it's a difficult concept only because it's kind of all over the place.
Well, hey, I wonder your thoughts about this. I know in my practice, I would sometimes find this odd phenomenon
Hmm.
where overdone results had become so common that people were bombarded with images of these results in the media and in person. And sometimes these looks would eventually become relatively mainstream and accepted. So much so that after time, I would get some patients who would come in expecting this kind of outcome or even asking for it. Like, I want fake looking breasts or I want overdone prominent lips. What are your thoughts on that?
Well, I agree with that, although there is people out there who want to create a very unique type of a look. They walk into a room and they like that people kind of notice them. But that's that whole thing with the body image and what the mind perceives and all this kind of stuff. So it's a very difficult thing. But my goal, actually, I would much prefer to have people not know you've had plastic surgery done than to have people know you've had plastic surgery done. Okay.
Yeah.
So I'm very happy when my patients come back and I've done a face or neck on them and they go to parties and they come back and say, "Listen, it was great because the people just kept looking at me saying, well, you didn't have anything done. How come you look so much better?
Love that.
Did you lose weight or did you change your hairstyle or something like this?" And that's for me is a good thing. I like that.
Agreed.
Now, on the other hand, I've had a patient. She came in, she was about 55, and she said, "I want you to make me look as close to my 26-year-old daughter who's graduating from graduate school as you possibly can."
Oh, tough
I was like,
challenge.
okay. Again, that's very contra to what I would typically do. On the other hand, people look at her pictures as before and after pictures, and you can see the beforehands and you look at the after ones and she looks great, except the only problem is she looks like she's 30 years old. So anybody who hasn't seen her in 10 years or she goes to a reunion or something, people are going to look at her and go, "Oh, who's that?"
Oh, they don't even recognize her.
I'm not sure that's good. On the other hand, she's thrilled to death with it. So, who am I making feel better about themselves? Am I making the patient feel better about themselves? Or am I making me feel better with the outcome? That's the very difficult thing.
Yeah.
And I turn down about 20% of the people that I see for mostly the reason that what they want is not what I see that they need to have done. And so I will say to them, I really don't think that I can give you the result that you desire, and you should probably, ask somebody else to do it.
Ah. Well, how much of your current practice would you say is dedicated to correcting or improving results from procedures the patient received elsewhere?
So about 30% of what I do now are corrective surgeries on other patients. So it's a lot. It's almost a little unusual if I get a first time breast implant patient, because probably 75% of the implants that I work on are people who have had it done and have been unhappy with it or had complications with it. So,
Yeah, that is a lot. Well, let's get into what the listeners really want to know. What about this concept of bad plastic surgery? Is it just unfavorable results, or is it beyond that? What would you say?
yes, and that's really hard to define, because what is bad for you might not be bad for me. And it's just amazing what can be considered good versus what considered bad plastic surgery. Okay, actresses. And they always end up on the bad plastic surgery tabloids. One of the classic ones they have on there is Jennifer Grey.
Oh,
I don't
really?
know if you remember Jennifer Grey.
She's so beautiful.
Dirty Dancing, right? But so she had a very specific image, and that image was kind of a longer nose, and that was her. And so she had it done. She had her nose done. She had a very good result with it. And everybody said that was a bad plastic surgery because it changed the image that they had of her.
Yeah.
So it's truly difficult. Is what is good plastic surgery versus bad plastic surgery?
Hard to define. Yeah. Sometimes the result really is overdone or unnatural or problematic in some way. And sometimes it's really just the eye of the beholder.
Exactly. But then you also can throw in the body dysmorphic disorder.
Oh, yes. We've discussed that in a previous episode, but would you just take a minute to explain that to the listeners?
So, body dysmorphic disorder is something that, as plastic surgeons, if you look at the studies, they say probably somewhere to 10 to 12% of people who come into our offices have that. And essentially, what it is it's a small little problem or issue, but the patient perceives it as being much bigger, and even to the point where they perceive that as interfering with their life.
Yes, it's a psychological issue.
Exactly. Well, it's definitely a psychological issue. And unfortunately, not enough of the time we pick up on that. I have no issue sending patients to psychiatrists first.
Ah,
And if the patient says, no, I'm not going to do it, then that says, well, I'm not going to operate on you unless you see either one of these two psychiatrists that I work with, and they say that everything is, okay to go ahead and do.
so could you explain the concern about proceeding with a surgery in a patient who has body dysmorphic disorder?
The big concern is that if you correct what they're complaining of and their issue, you've taken away their crutch. And now they don't have their failures to blame on that issue. The classic example, if you look anywhere, if you look up body dysmorphic, that always brings up the male nose.
Ah,
Men come in wanting to have something done to their nose, and they will say something to the effect that, yeah, my nose is preventing me from getting this top job, and da 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 da, or going out with this person, or this type of thing. Then you correct it, and they still don't get their top job, and that person still won't go out with them. And so it is devastating for that person, and almost to the point where I don't know what the numbers are, but the suicide rate on people like that is very, very high. I have a friend of mine who's a plastic surgeon up in New Hampshire, and he had a young male that he didn't quite appreciate this issue with him. He did his nose, and he took the splint off after the nose, and he was like, oh, that's a home run. That's perfect. And over a period of time, this guy came in to harass him every other week. He would do bad reviews. And then eventually the guy said he stopped coming in, and the people looked him up and they had an obituary in the paper.
oh no.
So if you can pick up on it, kudos to you. If you don't pick up on it, it'll make your life very difficult. And the extreme of that is there has been a number of plastic surgeons who have been killed because of issues like that. And I'm sure you've heard of that.
Sadly, yes.
There's not as many as you think there'd be, but there's a lot of patients who are very unhappy.
Well, leaving body dysmorphic disorder aside and bringing it back to what bad plastic surgery might be, how do you help patients distinguish a problematic outcome from the natural settling of tissues with age, gravity, etc., the natural course of which might lead to the need for revision surgery?
Oh, and that's a huge issue. I push it right up front. I say, listen, you may not be happy with the result that you get right away. I will walk you through the time period. We wouldn't even think about doing anything for 6 months, and I don't do any type of revision on my own surgery for 1 year. And you'd be surprised how much it changes over that year period. And the classic one is the nose. The nose will keep some swelling and all this kind of stuff right in the tip, especially. And I tell people, I'll hold your hand, but we have to wait this thing through. And most of the people at the end of a year say, yeah, I'm happy with it. But right up front, the people know that I won't touch them for at least 6 months. And usually I won't operate on them for a year.
Well, I think it is hard for people. They're human and they're scrutinizing their results and looking in the mirror constantly.
Absolutely. With a 10 times mirror in front of their face. But you also get the other way around and you kind of hinted at it. So there are some natural things. It doesn't stop nature. When I do a facelift or something, I say it will set you back 10 years. But most of my patients kind of look at that as daylight savings time for them. It sets them back 10 years, but you're going to continue to age along the way there.
Yeah, I used to tell patients all the time that we can reset the aging clock, but we can't stop it. It's going to keep ticking.
Probably only done 2 or 3 redos at 10 or 15 years, but I always will tell them that you have to wait and let things settle in and all this kind of stuff. It is truly something most of my patients, and I don't know whether I've selected them that way or they've selected me that way, is that most of my patients just want an improvement right away and they will happy to be continuing on. And they actually want an improvement that most of the people won't notice. And they say they just want to look better. They don't want to exactly to have that real tight skin look, or they don't want a drastic change in their nose. One of the ones that is very difficult to kind of mask are eyes, only because post blepharoplasty, post eye surgery, eyes will be kind of much more open. And people notice that. The first thing you notice on a person is their eyes. When you go up to a stranger, some of the first thing you notice are their eyes. Well, all of a sudden, you've been seeing this lady for a long time or this man for a long time. And all of a sudden, you go, wow, what have you done? You obviously have done something. And it's usually the eyes that'll do that. The neck is mostly covered. Anything else body wise is covered. Time is just so important with all of this.
As we talk about some of the potential causes or origins of what we call bad plastic surgery, sometimes it can have to do with the treatment provider, but how much of the time does the patient, him or herself, sometimes play a role? Could there be unrealistic expectations or insistence on a procedure even when it's been advised not to do it? Or is the mindset of the patient sometimes a little bit distorted about what looks good? Or maybe they've never really seen themselves as they truly are. Do you think any of or all of those are playing a part sometimes?
I think it's all the above, actually. As you're going through this, I'm thinking I can tell you 5 patients that's exactly the way it is. The interaction between the plastic surgeon and the patient for that initial consultation is fascinating if people haven't seen it or witnessed it or haven't either been on either side. I'm sure you've been on one side of it,
Yeah.
but it's a fascinating thing on trying to decipher what that person wants and what you think they can do or would benefit from. I mean, the minor little thing is you have this patient come in and she has to have a mole removed and she's got a big old mole right on her chin over here. And you say, we can go ahead and take that off. She goes, well, that doesn't bother me. It's this little thing over here that bothers me. And you're like blown away, like, okay, that thing bothers me more than that thing bothers me. But you want that? Okay. So it's difficult to, as far as patient expectations versus what you can deliver to them. It is truly something that has to kind of be decided or identified beforehand, because it'll save you a whole bunch of hassles later. Great example, just recently, this lady had breast implants. They were old saline implants. They were firm, hard, and way up top. And she said, I want to have new implants in. Okay, fine. We put gel implants in. They looked fabulous right afterwards, and she hated them. And I said, well, why do you hate them? She said, I wanted them high and real firm and hard up top.
So they may have been firm before because of a complication known as capsular contracture.
Yes, that's exactly. And so you correct that, and all of a sudden she's upset because they're not firm, hard, and high. So it is truly one of the things that it is of both the patients and your benefit as a plastic surgeon to kind of appreciate that and understand that before you go into it. I will harp back on what I said before. If something that the patient is saying to me or something the patient wants doesn't jive with me, I turn them down. Truly, I know most plastic surgeons don't. They will try to accommodate what the patient wants. And I guess I throw my aesthetic values in there more than most people do. So you have a lot of people come in and demanding a plastic surgeon does something and they do it. I won't do that whatsoever. That's just my own personal.
And it sounds like you kind of established that up front.
Right. Well, it's truly one of those ones that I'd rather have them hate me at the beginning rather than have a bad outcome that I'm not happy with, they're not happy with. And then the other thing you get into the plastic surgeon, I mean, your work is out there. People go to cocktail parties and say, oh, who did your stuff? Dr. Francel did it. Oh, yeah, I'm not going to him. So, I mean, it's a advertising type of a thing too. I don't want to put something out there that I'm not proud of, but I can tell you it's probably 75% of the plastic surgeons here in St. Louis, that doesn't even cross their mind. If people come in and want to have something done and they have the money, it's done. So, yeah, you've probably seen that too.
Oh, yes. Well, going back to the provider or surgeon, how much does it matter who does a patient's procedure? And in your opinion, how much does training matter for a surgeon? Is the board certification crucial? And does it matter which board certifies the surgeon?
I harp on that a lot in the book about going to a board certified plastic surgeon, including giving the websites to the American Society of Plastic Surgery and the American Society of Aesthetic Plastic Surgeons and that.
Yeah.
Don't think you're seeing a plastic surgeon if you haven't asked about their credentials. Okay. Credentials are something that is very important because there's so many people out there doing plastic surgery that aren't credentialed to do anything surgical wise. And I guess we should kind of take a look at that too is plastic surgery is a surgical technique. So we have people here in town, Dr. Smith, plastic surgery. It's all over the billboards. It's all over, their office things. It's all over websites. What you have to be very specific is plastic surgeon. And it's different than plastic surgery. Anybody can perform plastic surgery. A plastic surgeon is specifically trained in plastic surgery.
What kind of training does it actually take to become a plastic surgeon?
In my day, it was forever, but in my day, we had to be board certified in general surgery, and then we had another 3 years after that. The board certification right now, you have to have 3 years of general surgery, 3 years of plastic surgery. Then you have to sit for written boards, and then you have to sit for oral boards. So written boards is pretty much a day of taking testing, and then oral boards is interesting because they select cases that you present to at least two plastic surgeons who are in a room with you. It's a little different now, but
So intimidating.
yeah, very intimidating. The people who went through all of that, plus older plastic surgeons, are very well trained in that. And the problems nowadays that they don't have that as good training. I still truly recommend having a board certified plastic surgeon do your work. They at least have been exposed to complications. They have been exposed to all the stuff that can happen because all the academic centers are referral centers for people who have trouble. They end up there. And so we saw a lot of things. The classic one now is all the people having their plastic surgery done elsewhere, like Mexico, Dominican Republic. I mean, what they do is they show up in all these academic institutions. And I think NYU was saying, they spent $6 million last year on people who had had plastic surgery done somewhere else because they came back and couldn't pay for their care afterwards.
That's huge.
So that's a very important part of the training where people who don't have that training do not have that experience. We had a patient come recently and she called one of the big plastic surgeons here in town and asked, is that person board certified? And the person on the phone said yes. And the person said, well, what is they board certified in? And she goes, plastic surgery. And my patient who ended up with me says, well, that's interesting because I'm sitting on the American Board of Plastic Surgery website right now with it right in front of me, and they are not listed on there. And the response was, well, you must be on the wrong website. And the lady goes, no, I'm on the American Board of Plastic Surgery official website looking at members of the American Board, and their name is not on there. All of a sudden, click, the phone went dead.
Oh.
And so you have to watch out for, plastic surgery and all this kind of stuff. So with their board certification. Now, there's a lot of board certified that are not actually recognized by the American Board of Medical Subspecialists. So cosmetic surgery is not, facial cosmetic surgery is not, aging, board is not recognized as a legitimate board certification that has gone through all their training and stuff like that. There was a patient who came in to see me and she had a ruptured breast implant. And it was one of the older ones. And actually, the reason it was found out is that she went to have her carpal tunnel done. And when they opened it up, there was silicone in her wrist.
Oh, no.
And so what happened was the implant had ruptured, it had come up and gone into the brachial plexus, and it had migrated down into her wrist. So a fascinating case, almost unheard of case, but she ended up suing the original plastic surgeon. And part of her lawsuit was that he billed himself as a plastic surgeon, but he was only a general surgeon who was doing breast implants. The companies who make breast implants still release breast implants to non-board certified plastic surgeons. So
Well, do you think there are misconceptions among the public about surgical expectations and outcomes?
there definitely are. A lot of times I will see people complaining of something and they come in to see me and I will say, that's actually a really good job. Don't mess around with it because the only thing I can do is make it worse. People actually appreciate that.
And in the revisions you've had to do for patients treated elsewhere, are there certain procedures which seem to be more prone to bad plastic surgery, whether due to poor judgment or problematic technique?
That's typically the noses when you bring up the nose issue. I mean, Michael Jackson's a great example. You can make it worse if you keep on doing something like that. So typically with noses, unless it's something very evident, like the bones are not set right or something like that, or a little bit of a tip, then I usually will not, do that. Facelifts are interesting because the ones that I see now secondarily come in because they don't look natural. And so what you're trying to do is you're taking something that's really tight and trying to loosen it up, and that's a little bit hard to do. You can do it, but that's probably the most difficult kind of revisions. The other thing that makes that revision hard is a lot of those people have had some type of a therapy, some type of ultrasound therapy, heating therapy, or something like that to their neck, just because they get really kind of edematous, they get a little bit, fibrous tissue, they get a little bit scarring in there. It doesn't have a nice, easy plane to get into.
Gotcha. Well, do you find there is more risk of complications or even scar problems with revision surgery?
Oh, absolutely. You're talking about a regular, straightforward, first time in human tissue. You're probably talking about a complication rate less than 5%. Anytime you're going into the second ones, you're talking anywhere 10 and 15%. One of the things you hinted at too is what are the procedures that have the highest complication rate? By far and away, and I've seen it, is some type of a thigh lift where you're taking skin and fat from the thigh. There's a whole bunch of different complications that you can have with that. We see a lot of them. The official report in the American Society of Plastic Surgeons is probably about 40% of these people have some type of a complication.
Oh, I'm not surprised. Those are tricky procedures.
Healing issues, infection issues, open wounds, things like that. One of the ones that was hardest for me to actually take care of was a lady who went to a non-board certified plastic surgeon for some liposuction of her thighs. She didn't like the result. The skin was a little hanging, so he redid it, and it was worse, obviously, because they took out the padding part of it, so the skin was hanging worse. So she went to a non-board certified plastic surgeon who did a thigh lift on her. And subsequently, what happened was that it wasn't closed correctly. And every time she would walk, the labia, with her vagina was open and get air in it. And then as she walked, it was express in kind of a farting sound.
God, that's
It's
horrible.
a horrible thing. And there is actually a technique that was described probably 25 years ago that eliminated that issue. So when she came in kind of explaining it to me, I said, listen, I know how to correct it. Is it going to take care of it completely? I don't know. If you're willing to give it a shot, I know what I'm doing. So I think I can correct it. And we were able to. And all it is putting a permanent stitch that goes from the area on the thigh down to the deeper fascia over the muscle
Like an anchor stitch.
or in the pelvic bone. And if you have that solid, it doesn't pull back. And we were able to take care of a problem for her. But thigh lifts, 50% complication rate. The newest thing is the Brazilian butt lifts.
Yes, we discussed that in a previous episode.
So a Brazilian butt lift isn't really a lift. What you're doing is you're taking fat from somewhere else and putting it into the butt area. Typically, if you're doing that type of fat grafting, there's a thought that if you can put it into a highly vascularized tissue, it's going to take more. So a lot of the Brazilian butt lifts initially were at least put into the gluteus muscle. What happened is the gluteus muscle kind of expanded and there's an inferior gluteal vein that tore. And so the fat would go in there as an embolus and people would die. The interesting story behind that is in Florida, there was a bunch of them. And finally, the medical examiner called in all these plastic surgeons and said, listen, I got one of these. Will you show me what you do and see if we can figure out why all these women are dying? And that's exactly what they did. They took the gluteus apart, and there's a whole bunch of fat down underneath it, and the inferior gluteal vein had torn. And so there was fat in her lungs that she died from, the fat emboli. So that is by far and away, if the complication rate on that, somewhere around 25 or 30% of people have some type of complication.
Yeah, kind of high.
Sometimes the fat doesn't survive, so it can be anywhere between 5% and 90%. And so you can end up with nothing, or you can end up with an extra fat butt.
Good point.
And so people say, well, overgraft them with more fat than you think because some of it's going to die. Well, what if it all lives? And you see that in faces,
Yeah.
because the faces are very vascularized, so you can inject a face. And if you overinject it with fat, you see them. I mean, there was a photograph just within the last week or so of the cat lady.
Oh, no.
And she's always kind of wanted to look like a cat. And so all throughout her career after 50, she started to look that way. It's kind of the classic thing. You can look up cat lady, plastic surgery, and she comes up. But recently, probably over the last 2 or 3 months, she's had a lot of fat grafting put in. Interesting to go look at it. You will be shocked.
Wow. Is there sometimes a limited or maybe even distorted view of an outcome? Maybe the patient's not really seeing the full picture?
Extremely, extremely so. And I think what happens with people, you get these people now, Madonna's a classic one now, with a lot of cheek injections. And I've had a couple people come in and they say, oh, yeah, I went to so-and-so. And again, since I've known these people, I kind of confront them with that. I said, I'm not sure that looks good. And so they pull up their mirror right away. They pull up the mirror and say, oh, no, that looks great. I say, you're only looking at the cheek. Look at the whole thing. And at least 2 people have said, oh, yeah, that kind of looks weird, doesn't it? I go, yeah, that looks weird. Just a little story, because I'm telling a lot of stories.
No worries. People love stories.
I had a patient, she was a wife of a physician here, and she came in and we did some cheek injections on her. And she came in like 4 or 6 months later and said, yeah, I want to be a little bit bigger. And I was like, okay, yeah, we can do that, I think. I think that's okay. So we did some more. And she came back in, a year from the initial injection saying she wanted more. And I was like, everything is still kind of there. So why don't we just leave it there and we can kind of evaluate it as time goes on. This stuff should last for about a year or a year and a half, something like that. So why don't we get back together in like 6 months or so? And she didn't show up. And about 2 years after that, I was at a reception and my daughter comes up to me and yanks on my arm. She goes, what's the matter with that lady's face over there? And of course, you know the scenario. I turn and I go, oh my God.
Yeah.
So she obviously went to somebody else who didn't stop themselves from injecting her when she asked for it. And part of that is money too. I mean, a lot of people won't turn down the $600 or $1,000 for an injection. I do all the time. That's just an interesting story, and that people don't perceive that they look bad. I think what they're doing is they're concentrating on that one area.
Yep. And sometimes you have to evaluate the patient in the dynamic or moving state and not just the static.
Right.
And I think it is difficult sometimes for providers to say no, especially when you have an insistent patient.
Absolutely. And in this day and age, that provider restraint is hard. If people show up, and I've had it too, I just turned somebody down and she said, no, I will write you a check right now to do it. I was like, no, I'd much rather say no to somebody and have them mad at me up front than, a year later kicking myself for doing it. So.
Well, I know this has all been such enlightening information for the listeners. And if people are interested in finding your book called Exposing Bad Plastic Surgery, how would they go about that?
The easiest way is either on Amazon, Barnes & Noble, or Bookfinders. You can find it there. We do have a link on our website, drfrancel.com, that goes to where you can purchase it.
As we leave our conversation today, are there any lasting thoughts you'd like to leave the listeners with about our subject or about plastic surgery in general?
Probably the most important thing is plastic surgery kind of interferes with, the body image, but then also the mind. And as we go through all this, there's truly people who don't perceive themselves appropriately in the mirror. And we kind of hinted at that a little bit. But I had one lady who came in, she was 7 years old. She was referred by her family and did her facelift on her. And afterwards, she just didn't seem very happy with it. And I kind of said to her, I think that was a pretty good result. What aren't you happy about? And she said, I don't see any difference. And I was really taken back by that. And she said, my family say I look great and all that kind of stuff. But when I look in the mirror, I don't see anything different than what I saw before surgery. And so I pulled up her pre-op photos and printed up her post-op photos and put them side by side. And she said, well, that person's not me.
Oh, you're kidding.
So her perception of what she looked like was probably back when she was 40 or 45, but it was a solid, ingrained perception that that's what she looked like. To the thing that she did not appreciate the fact that there was a change. So if she wasn't 45 again, but she looked like she was probably 55 or 52 or something like that. And so she couldn't perceive that change. But again, the other issue is that, again, working with psychiatrists, people have a distorted view of what is attractive, and that's because of what you see out there. If you walk the streets of New York, you're going to see a horrible facelift, and some people think that looks good. So that's kind of hard. There's a cute little saying, beauty is in the eyes of the beholder. You've heard that?
Yeah.
Well, one of the psychiatrists said, beauty is in the eyes of the beholder, but feeling beautiful persists only in the mind of the beheld.
Great saying.
So they actually think they look beautiful. They go, don't I look good? And you go, But she perceives herself as looking good. It's a kind of a difficult thing to help people with, as my psychiatrist friend has said. So.
Well, Dr. Thomas Francel, thank you so kindly for taking the time today. Really appreciate it.
You're very welcome, Regina. It was a pleasure talking to you.
Likewise. Take care.
Bye-bye.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.